So, I am Ranarda Jones, and I had a lot of buzz at the Carolinas affiliate AMCP Day of Education event in Charlotte a few weeks ago. I had posted online on LinkedIn these circles, but they were all white, they were all blank. And everybody, once I got there, wanted to know, well, what's the deal with the circles? What's it going to be? And I'm hopeful I lived up to the hype, but what these circles actually represent is the different coverage stages due to the Inflation Reduction Act. So, what is happening to the Part D prescription drug benefit phases because of the Inflation Reduction Act? So, if you recall, or if you know, or you may not know, but there are currently 4 Part D prescription drug stages. There's the deductible phase, there is the initial coverage limit or ICL, then we're followed by the coverage gap, also known as the donut hole, and then finally the catastrophic phase. The Inflation Reduction Act, or IRA, is making some major changes to these 4 prescription drug benefit stages. So your deductible phase is always going to be the same as it is right now. I do not have a pictorial slide for the actual deductible phase. It works the same way as it does in commercial. So basically, you are, as the member, are going to pay 100% of the cost of your medications until your deductible is met. Now, we do know in the world of Medicare, there's several tiers of these drugs that are excluded from the deductible. And usually plans put generic drugs on these tiers or drugs that are related to our quality metrics or star ratings. And then they usually attach like a very small copay or $0 copay to it. And so whenever the member goes to fill the prescription on day one, it is going to be whatever that copay is. It does not apply to the deductible. So CMS gives a cap of what that deductible can be. And then the plan can choose to have a lower deductible or the max deductible, whatever. However, with the Inflation Reduction Act, there are going to be some changes to our other 3 stages. So what we have first is going to be our initial coverage limit. And this is representative of 2023 and it's also representative of 2024. What you're going to see in the blue is going to be our plans. What's in purple is going to be our beneficiaries or Medicare beneficiaries, so your actual customer, your patient. What's going to be in yellow, pharma or our drug manufacturers, the drug companies, and then what you're going to see in this, what I thought was gold when I painted it, but it's actually brown color, is actually going to be the government. All right, so the initial coverage limit in 2023, meaning right now, and in 2024, so there's nothing changing between now and next year for this particular phase. So once the member leaves the deductible, if there is a deductible, they go into the initial coverage limit. In the initial coverage limit, you're going to see that the plan is picking up the majority cost of the drug and the beneficiary is picking up what is left. So you can see that from here, the blue. All right. So your plans are actually going to pick up 75% of the cost, and the beneficiary is going to pick up 25% of the cost. Now, you may not see that as a 25% coinsurance when you're looking at benefits, but actuarially, it's going to have to be equate to 25% of the member, and then the other 75% is the plan. In 2025, you can see that that is changing. Okay, so 2023 and 2024, the initial coverage limit is going to be the plans picking up part, the beneficiaries picking up part. But when we get to 2025, this ICL is going to change. And it's changing because now pharma or your manufacturer is going to pick up a piece, the member is going to pick up a piece, and then the plan is going to pick up a piece. So what you can see is the blue portions have gone to, instead of 75%, is going to 65%. And you can also see that the manufacturer had no part in the ICL in 2023 and 2024, but they're going to pick up 10% when we get to the ICL in 2025, and then your member is still picking up their 25% of the cost of that drug. Okay, and then, so let's put this back here. In 2023, after you leave the initial coverage limit or the ICL, which means the total drug spend has reached a certain amount that is determined by CMS, you're going to go into the donut hole, or also known as the coverage gap. This donut hole is applicable for 2023, meaning right now, and 2024 next year. So this applies to your brand name drugs. So the drug manufacturer currently picks up 70% of the cost of all brand name drugs. The plan picks up 5%, and the member picks up 25%. If this was a generic drug, the plan will pick up the entire 75%, and the beneficiary will pick up 25%. So it would look just like our ICL phase. So for 2023 and 2024, you can see pharma is paying 70% of the brand drug, the plan is picking up 5%, and the beneficiary is picking up the remaining 25%. What gets somebody out of the donut hole and into the next phase, which is catastrophic, is known as their out-of-pocket. So everything they paid in the deductible phase, everything they paid in the ICL phase, and what the member paid in the donut hole, including what pharma pays on their behalf whenever it is a brand name drug. So 95% of the cost of a brand name drug will go towards that member's max out-of-pocket to get them into catastrophic. All right, so you won't see any more donut hole disc. And that's because the donut hole is officially going away, so to speak, after 2024. So what happens then is we're going to put this to the back. And let's look at catastrophic. So in 2023, our catastrophic phase, which is our final phase, remember, not all members make it through all four phases. Just because you get to the ICL does not mean you're going to get to the donut hole. Doesn't mean you're going to get the catastrophic. But that's a conversation for another day. All right, so here is our catastrophic for 2023. And you can see right now, currently, the government is picking up 80% of the cost of the drug. The plan is picking up 15% of the drug, and the beneficiary is picking up 5% of the drug. In 2024, which I will make sure to show you on the plan finder because it's already in place. In 2024, however, the beneficiary no longer has a piece of the pie that they have to pay. So the plan is going to pick up that 5% that the member was responsible for in catastrophic in 2024. So if a member makes it to the donut hole and makes it out of the donut hole in 2024, they no longer have to worry about paying that 5% in 2024. The plan is going to pick that up. The government's still going to be picking up their 80%. This 80% is also known as reinsurance, which is reinsurance is insurance for the insurance company. So you'll see that mentioned there. All right. Then, so what happens in 2025? Since this is going away, I'm going to use this easel for this. All right, so once we get into the year of 2025, because of the Inflation Reduction Act, catastrophic, the member the member no longer has a cost share, but what you're going to see is a shift from what the government is paying to the plans. Okay, so remember, in 2023 the government was paying 80%. In 2024 the government was paying 80%. However, in 2025, when they get to the catastrophic phase, the government now is only going to pay 20%. You also see a new player. You see the drug manufacturer in here. Remember, there was no drug manufacturer cost. The drug manufacturer didn't pick up anything in 23 and 24 during catastrophic. They picked it up during the donut hole in 23 and 24, but this is going away in 2025. So therefore, the drug manufacturer is going to pick up in the ICL during 2025, and they're also going to pick up in catastrophic in 2025. The plan now picks up 60% of the cost of these drugs once the member hits catastrophic. So what you can see from these slides is a couple of things. you can see that for 2024, the main change is going to be for the beneficiary. The beneficiary is no longer going to have to pay anything once they hit catastrophic. So that is certainly a win-win for our Medicare beneficiaries. The other big thing to note is that the donut hole is going away. Okay, so your donut hole is going away after 2024, and it is a very confusing time for members whenever they get into the donut hole, but this is going away. So that's another key thing to note. So the other big thing that you want to note for 2025 is for the plans. Plans are going to go from paying their 15% of the cost of the drug to 20%, which is not that big of a deal, but going from this 15, 20 to 60% is going to be a huge deal. Also note, during catastrophic, for most of these people who get to catastrophic, the only way you got there is because you are on a lot of drugs or you're on very expensive medications. We'll talk through that on another slide. I don't want to overwhelm you right now, but just know that the plans are going to have to be prepared to pick up a bigger chunk of these more expensive patients once they get to catastrophic, whereas in the past, 23, 24, the government was picking up the bulk of those costs. So I hope that this was very helpful. I got some great feedback at the Carolinas Day of Education that several people said they learned something new that day, and they gave me 30 minutes to do Medicare updates, and I am proud to say I finished in 20 minutes and still got people that said they actually learned something. It wasn't overwhelming. I love Medicare. I love to talk about these things. There's so much guidance that has been released. I'm here for all of it. So if you have any questions, please drop a comment below. Hit me up on my email address or my social media campaigns, whatever the case may be. Anything revolving around Medicare that I can be of service. If I don't know the answer, pretty sure I know where to look. And we thank you so much for all your excitement that I generated just by having blank disc on something. It was me working towards something, and so I'm glad I was able to build up some anticipation for the event. So we appreciate you spending a few minutes with us just to go over the prescription drug benefit stages and how they're going to be affected by the Inflation Reduction Act. There's a lot more to come. There's a lot of guidance that has been released. Please stay tuned as we continue to try and update you all in a fun way. Not everybody lives and breathes Medicare like some of us do, so we try and break it down into chunks so that you'll be able to understand it as well. So thank you, and enjoy the rest of your evening or day whenever you're watching this video. Again, we appreciate it.